My salutation and pranams to you, sir, for accepting to give us time this morning to interact with us.
Thank you.
And my prayers to the divinity in everybody here. And sir, with this, quickly, it will be short few questions. And sir, the first one I'm thinking in two part. One is you have established the Swaasthya Hospital in Madanapalle in your ashram. What is the objective and purpose of this hospital? And there is a continue to that particular question. Based on my I had an opportunity and good fortune to interact and meet several spiritual phenomena and leaders like you. They all have the same practice of establishing education institution first, then healthcare institutions, and then trying to serve people. So what is the reason behind it? Why? See, there are certain sadhus and realized soul in Himalayas, they live on their own. Whereas people like you, when they come into the community to help the people to uplift, they choose this health services as one of the aspect of services. What is the importance and significance of it?
Yes. Anyway, thank you for helping us out with the Tata Diagnostics. Apart from that, I've known you for some time, so you kind of know how I work and what we do. First point is the name of the hospital is Swaasthya Hospital. Swaasthya means well-being. Now, well-being is required for everybody. The ancient Vedic dictum is Sarve Bhavantu Sukhinaha, let the entire world be in Sukha. And illness is always Dukha. I think education and health care should be as much as possible available to everybody. You go around Madanapalle, there are hospitals, but we feel that something is missing. So we want to do that here, to bring about what is not available and give it to the public, especially of the lower income group, so that we can provide. Now you ask me why some yogis sit in the Himalayas quietly and some people do this kind of work. I can only tell you about myself. My master, Maheshwarnath Babaji, who is a senior disciple of Sri Guru Babaji, was like the one you described. He had no organization, no banner. He wouldn't even get into a vahan, to vehicle. He wandered freely in the Himalayas. But such people also sometimes decide that somebody should be doing something for humanity, because the whole Upanishadic dictum is Atmano mokshartha jagat hitayecha. Now, jagat hitayecha, health is very important. Health is wealth. You can have everything, but if there is no health, it's miserable. Life is miserable. So Babaji decided that I should go out and do work. In a way, I was made the scapegoat, but it's not like bad. I would have also wished to be somewhere in the Himalayas happily walking around. He said, no, this is your job. You do it. So I came here. People who know me from the beginning, they know that when I came here, there was only one house here, nothing was there. It just came. I don't say I did anything. It came about. Everything grew. And now we are in this position. I said the best thing to do now for us, we started with educational institutions first, providing education. Dhyana is a very important aspect. And when we say education, not getting degrees and just getting marks and no, jobs. It's actually to help to flower the mind. Our boarding school is called the People Grow School, because the people tree, Ashwatha, is so important. I wanted to call it Ashwatha Vadam. Nobody will understand. Unfortunately, that is the state of Sanskrit today. Nobody will know what is this. So we called it the People Grow School. Even today, though we have classrooms, children sit around trees and study. Swadhyaya is very important. You know the first sentence of the Sadhana Pada of Patanjali's Yoga Sutras. What is that? Tapa, Swadhyaya, Ishvara Pranidhanani, Kriya Yoga. He calls it Kriya Yoga, of course. So therefore, this is the work. Then we said, health care also is important, because if you are not healthy, how are you going to do anything else? Study? Nothing is possible. So we slowly started a small center here. Swaasthya Kendra has been going on for many years. This lady here has been looking after it for so many years. Then we got a chance, we just got an idea, okay, let us start something better, helpful. We conduct workshops regularly among the rural people. So, I don't know, we just got the idea, we set it up, and we started with nothing. Then some good people came around and said, please don't go and ask for money anywhere, we will do it for you. So the hospital has come. Just as you said, okay, we will do something for you, like that. So I am saying that while education and healthcare is very important, I don't think I am doing it. It's part of the whole process of a yogi living in this world. That is the best we can provide, as much as we can. This is why I am here, not because I want to take photographs or go. I would have preferred to be like Babaji, but he said, you do what I ask you to do, I am doing it. Because you asked me about the contrast. Now please remember, that man sitting in the Himalayas doing nothing has got all these things done. Sitting there, doing nothing. So therefore I keep saying, in meditation, the more you go towards that which is nothing because we cannot define it, the more things happen. We are going towards the ultimate, because that cannot be described in words. Even the Buddhists simply call it Shunya. Shunya doesn't mean nothing. It means not a thing. That's what it means. So, this is what you see happening, and it has all happened organically. We don't have the money to suddenly invest it, do something. Slowly. Once upon a time, when Mr. Mohan Kumar was the secretary of the Satsang Foundation, our Satsang Foundation account had 50,000 rupees. Nobody was there. They all used to wonder. Suryadev was there. Used to wonder what is going to happen. I said, Babaji has asked me to do the work. Babaji will do this. Is come here.
Fantastic. So now just take from learning from this. So when you go for a medical doctor or treatment or anything, they generally recommend you to do physical exercise.
Yes.
And then to be careful on your food and diet.
Absolutely.
Along with the medicine.
Yes.
So that is more of a physical exercise.
Yes.
But when we do like Japa, the chanting or Dhyana or Kriya, those activities or exercises, how does it influence the physical health and also mental health?
Okay. Yeah. So physically we do exercises for the body. Even if you have a heart attack. One day I was having a discussion with somebody, and this guy said, I don't want to do Surya Namaskara. I said, why? Because in our religion we can only bow down to God. We cannot bow down to the sun. I said, wait, between you and me, if you have a heart problem, if the doctor says you do this, will you do it or will you die? What will you do? No, I will do it, because body has to. Right. I said, if you don't want to bow before Surya, go into a room and shut all the windows and just bow down there. Do the Surya Namaskara there. No harm, there is no Surya there. You say you are bowing down to God and do it. Why not? You see, so the very fact that a doctor, when you are sick or convalescing, is prescribing certain exercises for you, means exercise is required for the body. You asked also about the mantras and japa and mind. It's not that the physical exercises in our Indian tradition, apart from Gusti, are the yogasanas. Yogasanas are not meant only for physical well-being. Yogasanas put into proper shape your endocrine system. You know the endocrine glands which take care of so many, in fact the master gland is the pituitary, takes care of so many things in our body. Our moods change according to the hormones that come into the bloodstream from endocrine system, right? So asanas also deal with how to manipulate or how to make something less, something more. When you say I'm in meditation, I feel very good, it means there is more serotonin in your system. And if you see vision, there is more dopamine in your system. If it goes too much, then we are in trouble. But otherwise, so asanas and pranayam help to bring this change in you, so that not only you are physically healthy, it also affects your mind. After all, moods, mind, everything becomes chemical, and the asanas help a great way to deal with that physical exercise. Now you said mantra japa. Well, mantra japa is meant primarily for the mind, because if the mind is not healthy, the body is definitely going to get sick at some time. So it actually connects both, but primarily the mind, and from mind that which is beyond the mind. Because only when the mind becomes completely free of its vrittis, yogas chitta vritti nirodha, then only it gets the tarmac to go to higher levels of spiritual consciousness. At the moment maybe somebody doesn't want it, but it's a preparation to go into the higher levels of beyond even the mind. But for that the mind has to be properly balanced and treated. And each of these mantras, you may pick up a mantra from a book and chant, okay, fine, even that is alright. But in the mantra shastra, from the Rig Veda down, all the mantras, and of course the tantra, all the mantras have been set in a particular way so that when you chant it, the sound affects you properly. You can simply chant a mantra. You can sit down in the morning and say, oh, here is the Taittiriya, Shanno Mitra Sham Varunaha Shanno. Well, it's okay, better than nothing at all. But when you look like the Vishnu Shukta, when you look at it, you will find that there are some marks on it, where you go up, you come down, you go. When you do that, the mind's rhythm falls into a particular design. What is affected, what has to be affected is then. Instead of, so therefore when you say, for instance, this is because I like to always use what begins the day, like Shanti Pata, Taittiriya Upanishad is what you begin chanting. Shanno mitrasham varunaha shanno bhavat paryama shanna indro brihaspati shanno vishtururo kramanamo brahmane namaste vaj tvameva pratyaksh. People say, why are they going up and down? That rhythm is one that establishes what change can take place inside. So if you really study it and do it, it has a different effect. Otherwise also it is better than nothing at all. So this is, the science of mantra is vast. In fact, they have researched so much on it that they have written that these mantras are meant for this effect. And basically it puts your mind into a very... Now, of course, yama niyamas are required. If I say, every day I will do Gayatri, every day I will do Purusha Shukta, every day I will do Vishnu Shukta, but in the evening I will get drunk, it doesn't work. You have to control your senses. All animals and human beings have senses. If the difference is that a human being can control and do what he wants, animals will do what, you don't want to go back to the animal line, right? We need to control our senses. So, if there is a control, and if you don't allow your brain to get muddled up with alcohol and things like that, unless you know where soma juice is available, which nobody knows, at the moment. Then your mind grows, your body becomes healthy, and you lay a bridge towards the spiritual, which is your true essence. So this is the importance of mantras. It's also the importance of having a yajna, lighting a fire. It has its own effect on the mind. It burns away all the bad influences. The aushadas that you breathe in, it helps to increase. But always such things should be done a little bit in open air where there is ventilation. You don't want to get suffocated. So these are some of the ancient times. There were no priests, no particular priests. Today we have to hire priests because we don't know what to do. Every human being used to do his own havan. Now nobody knows, so a priest has to come. So a priest has become a profession. So once we go into this and understand, then it's good for body and mind.
Fantastic, sir. And whatever mantra if you give, we will try to do it in the hospital and properly.
I think there is something called Sri Shukta and there is something called Vishnu Shukta. This can be recorded. If patients don't want, it's okay. But those who are in bed, especially inpatients, they can listen to it if they want. Believe me, it will increase the chances of being cured at least 25%.
So given the technology now, we can personalize and whichever the patient wants, we can give it to them.
That will be a little difficult, but we can give the general ones, for instance.
Sure, sir. Sir, can I move on?
It is provable.
No, continue, sir.
No.
I'll just take it to little further on the same conversation, sir. See, it is said that to be born as a human is very, very rare. And also within after born as a human, coming in contact with a spiritual phenomenon like you is very, very rare. And most of the human which is born are necessarily get inflicted with the pain and pleasure, and which is considered to be, it is inherited from several births of yours. Now, the phenomenon like you, I understand that has an extraordinary ability to heal anybody at any point of time. At the same time, you also choose to conduct the traditional or a practice of a health practices like the hospital. And how do you mix and match this? Whom to do what and how to do it, and how does it work?
This, I don't know if I live about, since you are talking about me, 95% of my mind and my life is intuitively living. Only 5-10% is working in this practical world. But people cannot understand that. They understand only the practicals. So you have also to indulge in practicals and make them understand. If we start healing everybody, say all come in one line, what is it? We don't need hospital, but that's not the way life is. Life is that every action has to have a reaction. It has to go according to the karmic movement, right? The person on the deathbed, we look at the person and we know that this person's time to go has come, right? There is no point in stopping this. And you have to move accordingly. And we are not in the business of attracting followers. So we don't have to do that for that.
So just
there is another thing you can do, which may interfere with your larger work. Nothing else work. Instead of that person you can fall ill, but then all other works will be in limbo.
That is also very, I've seen that few times, but it is a very peculiar situation from.
But then we have so much other works to do, right? Which we have been ordained to do. So we cannot always do that.
Fantastic, sir. That shows the compassion of you and the overall model.
More the overall model than me.
So just to move on to today's world, see if you take India today, it is expected about 430 million Indians are going to become obese by 2030. Slowly, see in healthcare we say acute, 400, that basically in today we say diseases of acute in nature where they come to the hospital, get treated and go. There are people have developed chronic diseases. The chronic diseases like diabetes, hypertension, obesity and all is growing rapidly. And it has become we call that as a lifestyle diseases.
So you know the solution. Change your lifestyle.
So the question is, what is your guidance to change our lifestyle?
There is a golden rule. Don't indulge too much and don't not indulge at all. Krishna says that beautifully in the Gita when he tells Arjuna, the golden principle is, this yoga is not for him who eats too much or eats too little. There are people who want to improve health and they starve, they will die, nothing will happen. Neither eat too much nor eat too little. Neither sleep too much nor sleep too little. Indulge, but up to a certain point, not too much. If some moderation can be brought into, then I can assure you that these lifestyle diseases can be handled. Apart from taking medicine and doing treatment after they have manifested. I'm saying preventive. Ayurveda, for instance, is a very important preventive method. It's not so much for a chronic disease or for an acute disease, you may not get a quick solution in Ayurveda. But it goes to the root, checks and says, so Dinachara is prescribed, lifestyle. Without lifestyle, no Ayurvedic medicine will work. Nowadays you get it in the counter and you start eating, but you are not changing your lifestyle. Imagine somebody having Chyawanprash every day and also every day having 2 pegs of whiskey in the night. Oh, it's the most dangerous thing to do, I am telling you. It doesn't work that way. Only negative results happen. I'm not saying that you should not have a little alcohol one, it is vegetarian, that's okay. But it should not become your life's possession. Like without that I am not okay, without that I can't function. So you have to change your lifestyle. Now the most important part of lifestyle, apart from this, is good air to breathe. If you have good air to, you just check what is the oxygen content here and what is the oxygen content in the town in Madanapalle. Don't go far here. There will be a marked difference.
Wow.
You know why? Trees. So always encourage growing trees, breathing outdoor. If you go outside, otherwise, the other day I was checking, in Delhi the pollution level was like 400, 380. In Madanapalle it was 7.
Wow.
I'm not saying only Madanapalle. What I'm saying is lifestyle change need not mean only diet. The air we breathe is important, so you must keep your environment clear, so the air that you breathe is clear. These are some of the things that we need to do to get control over lifestyle diseases. Then, whole day you sit looking at the computer. Now, how do you expect your eyes to grow better, or will they deteriorate? Go. Then you sit, always people have learned from childhood to sit like this. What happens is that the spine loses its resilience. From childhood, if you learn how to keep your spine straight, even you don't need this also, you can simply sit without any support, then the diseases that affect your spine, your back pain, how many people are there? They say everything is fine but I am miserable because of my back pain. All this can be avoided. Preventive steps have to be taken. Changes have to be brought in the lifestyle. Then lifestyle diseases, I am not saying they may disappear totally, but certainly up to a certain level they can be controlled. That's my understanding.
Thank you, sir. Fantastic. So just move away from healthcare. One, your personal spiritual question. And last question. But it has 2 parts.
Oh. Okay.
Sir, throughout your life journey, that 3.5 years you spent time with your Guruji in the physical presence of him and traveled everywhere. By reading your books and interacting with you, looks like within that 3.5 years, there's a lot of knowledge and packed and given to you. And you seems to be extremely proficient in several languages, proficient in several subjects, and pretty much in scriptures and Sanskrit, your abilities are fantastic.
I don't know. Okay.
So no, we have to, we are witnessing it, so we are saying that.
Okay.
So that means it's extremely mind-boggling to understand. How did you get it? Second part to that is, sir, in your life story, see, we understand that you have been a spiritual person in several lives. So which is what here and there it appears in glimpses and when you narrate about yourself. If that is the case, the actual Atma-sakshatkara realization you had in this life or earlier itself, or if it has happened and when it has happened.
You know, what you call Atma-sakshatkara is rather difficult to define. I think the starting point, it's an unending process, not as once, no. The starting point is when you actually understand that you are not this body. This is the starting point. Then you begin, then the rest of the lives may be, if I am not this body, then what am I? That continues till you finally hit the goal. So, if you say, was there one point where it happened? Yes, it happened in a past life somewhere when I realized that this is not the body. But then I still didn't know who I was. So it went on and went on and went on. If you read The Journey Continues, you will see how much I have to go through, so many things. And then finally, I think one day, I came to understand what my true essence is in this life.
Fantastic.
That much only I can tell in this life. And that too, before I was sent out to do this job which I am caught up with now. Otherwise I wouldn't have survived. Because there are pressures, there are pull from all sides. I would not have survived if I did not know fully that I am not only not this body but something else altogether. Which fortunately everyone is. We need only to figure this out. So, to your question, two answers. One is yes, at some point in my life the whole thing started off. How many people start off? They don't start off at all. Then in the Gita, Krishna says to Arjuna, in this life, among the millions of people who live, one gets this desire for moksha. That point happened somewhere. Among thousands who have that desire, some find the way. I am not discouraging anybody. Who knows, they may all have finished everything in their past life. Who knows? Now you don't know. Okay. And that is the encouraging thing. Who knows who is sitting here? Maybe great yogis who just on the point, who knows? Or maybe many lives, we cannot define. Among the many who get this desire to understand the truth, one sees the path. And among the thousands who, this is not me, Krishna in the Gita, and among the thousands who walk the path, one reaches the goal. So I think I am fortunate. So maybe I may not have reached, not now, I know, yes, okay. Thank you. I can only say that. Because the moment I begin to say that I have reached the truth, I have not reached the truth. Because when there is the truth, I am not there. It's like the sun, no? Sri Ramakrishna Paramahamsa said, that a salt doll went to measure the depth of the ocean. Salt doll measuring the ocean. How long will the salt doll last? It will all get dissolved in the ocean. So, to function, we have a temporary personality here. The moment the job is done, this will disintegrate, and it will be remaining the same as before. That's all. I don't know when it will happen. I am happy anytime.
No, we want you to guide us, continue to guide us for a long time.
How long, sir? I'm 75 now.
So thank you for this, sir, and it's a fantastic time we had, and then it's a great opportunity to do it. And thanks for giving all the details about what was the question we asked you.
Thank you.
Thank you, sir.